Bismillahirrahmanirrahim. Assalamu alaikum. My name is Dr. Muhammad Umar. I am working as pediatric nephrologist in New Hospital. So today's the topic of paper presentation is the comparison of two different techniques of peritoneal dialysis. In pediatric population, especially smaller children, the only option for dialysis is the peritoneal dialysis. As the children lesser than 10 years, the hemodialysis cannot be done. So according to International Society of Peritoneal Dialysis (ISPD), the first line recommendation or first line of treatment for acute kidney injury is peritoneal dialysis. Although in elder children weighing more than 14 kg, hemodialysis is available, but again the PD is the first choice as it can be done in unstable childs and it can remove the endotoxins as well. So these are the different types of the catheter which is recommended by the International Society of Peritoneal Dialysis (ISPD) 2022. Although these guidelines, different guidelines available from 2016 and onward. So the tank of catheter is the most first line catheter, but it is costly. Then the Saldinger technique catheter, the Nijet catheter, and then the improvised catheters can be used as a safe line technique in resource limited countries like Pakistan. So we have compared the rigid catheter with improvised catheter with regard to efficacy and number of complications. So the objective study was to compare the efficacy in terms of decreased serum creatinine level after 24 cycles of the PD and the complications during this procedure. This was basically experimental studies. We cannot perform the randomized controlled trial because of the certain ethical issues and the lack of the resources. So we prefer to perform experimental studies at the Children's Kidney Center, New Hospital, over a period of the 2 years, 21 and 22. And we used the convenience sampling technique for experimental. We enrolled all the patients from neonatal age up to 12 years of the age in which PD was indicated due to any reason, and excluding criteria was the children who were unable to undergo the peritoneal dialysis. Written informed consent was taken from all the parents before the start of the peritoneal dialysis. Selection of catheter was purely on the basis of availability of the catheter.